I want to bring to your attention a website that is a source of misinformation about the COVID vaccine. It's called the Daily Expose. You should avoid this website. They link to a report from a good source of information, Public Health England, so that's a reputable organization, but the Daily Expose misrepresents the data as being the exact opposite of what the report shows. They have the snippet of a table from the website that shows some numbers of people that have the Delta variant and either died or required some emergency care. And they are focusing on the data regarding people over 50 that are highlighted there. And this is all in England. They highlight this one row that shows there were 9,571 serious cases of the Delta variant in people over 50. And of those, only 976 were unvaccinated. And I'll read the paragraph here. As you can see from the above table, the number of people over 50 who are fully vaccinated with an alleged confirmed case of the Delta variant outnumber those who are unvaccinated by 3 to 1. So it just so happens that, according to this BBC article, 95% of people in England over 50 have been vaccinated. So only 5% unvaccinated people over 50 in England. So very few people unvaccinated. That's why there are so very few showing up in this data. If you have a good feeling for numbers, that should be all you need to know, that this Daily Expose article is disinformation. But we can do a little bit of math. 5% of people unvaccinated in the total population. So 5% times 20 equals 100%. So if we take that 976 figure and multiply it by 20, we'd get a sense of how many people might have the Delta variant if everyone were unvaccinated. And 976 times 20 gives you roughly, well, 976 is about 1,000. So 1,000 times 20 is 20,000. So 20,000 people would have a serious case of the Delta variant or be dead if everyone were unvaccinated, as opposed to just the 9,571 that have it today. Of course, I'm sure it would be much, much more than that because those people would be giving to others, and this calculation is just a back-of-the-napkin calculation. Don't quote this 20,000 figure, but at least it gives you an idea of those numbers, what these numbers mean, if you want to draw any quick conclusions off of them. Of course, I wouldn't bother doing those calculations if I were you. I'd just go to the very same report that those numbers are lifted from, where they just describe the effectiveness. If you have 2 doses, the vaccine effectiveness is 79%. So that's from the Public Health England. If you just look at what they're saying as opposed to drilling into some, to pick and choose some numbers and drawing the wrong conclusions from them.